It's all sort of centred around the needs of the person, and similar to what we identified in our previous document, that not everyone is the same, and everyone will require a different type of service configuration. So we really needed to acknowledge that if we're centred around the needs of the person, that some people will have needs which are straightforward and predictable, whereas other people will have needs that are complex and persistent. So our service system needs to be responsive and be able to kick in with the right type of service at the right time when needed to respond to people's needs. So the guide, what are the key points in the guidelines and what are the key elements? So I think, as I said, firstly, the guidelines based around this population needs and a person-centred approach, and they recognise that people have different levels of needs. PCA's position is that palliative care is everyone's business, and this means that all health professionals who provide care to people with a life-limiting illness and their families, they must have minimum core competencies in the provision of palliative care, and this means everyone. All health professionals need to have these minimum competencies. PCA refers to this type of care that all health professionals provide, including general practitioners, as palliative care. And this is an important point I want to emphasise. We're now naming this as palliative care. Everybody provides palliative care. Some people have referred to this as general as palliative care or palliative approach. Really, we want to actually acknowledge and name that everybody should be able to provide a level of palliative care. Of course, though, some people have more complex needs and will require a higher level of skill and capability of their healthcare team. That's specialist palliative care.